Hello, everybody, and I'd like to welcome you to our latest Ask the Leaders Facebook live event, and thank panelists and those watching live and after the event on Facebook. For those of you that don't know, I'm Keith Aspden. I'm the leader of the City of York Council and also the chair of the city's Outbreak Management Advisory Board. And hopefully some of you will have seen our Facebook live events in the past. We've held a lot of them throughout the pandemic on a wide variety of different topics. And today I'm delighted to be joined by colleagues from across public health, the NHS and local business. And I'll go later to make sure everybody can introduce themselves to you. We'll be taking your questions on a variety of topics, including isolation guidance, vaccines, public health, as well as business support today. But before I go on, I'd just like to really take the opportunity to say thank you again. So thank you to residents, volunteers and businesses who have all played their part in our efforts to protect our city. And whilst it's been a month now since restrictions were removed, as a city, I know that everybody keeps pulling together and very much putting into practice protect, respect and be kind, appreciating that some may well still be nervous at this time. And we know that the last month has been really challenging, but equally really important to our local businesses. And whilst many challenges remain, we continue to see positive signs emerge. And just one example, the Centre for Cities High Streets recovery data revealed that York has the 4th equal best footfall out of 63 cities and towns across the UK, with visitor spend above pre-pandemic levels. Over the past year and a half, residents, businesses, key workers, volunteers, communities have put in an awful lot of effort doing everything they can to keep York safe. And I very much hope that it's in that spirit that we all continue to harness that recovery and move forward. This Monday saw new guidance on isolation changes, and this is something that I know we're going to be talking about later today. And similarly, just to remind everybody watching that support is still available from the council. And I know as you're watching along on Facebook Live, members of our team will respond to any of your questions that you can put in live. And similarly, we'll put up some information about how you can access that support if you need it. So before I go on, I'm going to go around in no particular order and obviously thank each member of the panel for spending their time with us today. So this is the order that you appear on my Zoom screen, and I'll go to Mike first.
Thanks, Councillor Aston, and good evening, everyone. My name is Mike Holmes. I'm a GP by background. I'm a partner with Haxby Group in the city, and I also chair Nimbus Care, the organisation that's been delivering the vaccines from Aston Bar.
Thank you very much, Mike, and welcome. And next is Daryl.
Yes, good evening, everyone. I'm a councillor and fortunate to be City of York Council's exec member for Culture, Leisure and Communities.
Thank you, Daryl. And then to Michael.
Sorry, momentarily couldn't get myself off mute. So yeah, I'm Michael Yords. I'm the chair of the Business Improvement District. I'm also a local restaurateur at the shopping block at Melton's, and I am the director of the Food and Drink Festival.
Thank you very much, Michael. And I always like it when everyone can see and prove that it's a live event that we're taking questions on. Sharon.
Hello, everyone. I'm Sharon Stoltz, and I'm Director of Public Health for City of York.
Thank you very much. So once again, thank you to the panelists that are going to be answering all of your questions later. If you haven't watched one of our Facebook Lives before, we have a number of questions, some of which have been submitted in advance, and I'll be trying to keep them in themes. And as I mentioned, that will be talking about the latest isolation guidance, vaccines, and business support. But if you're watching along and you have a supplementary question on one of those topics, please ask it on Facebook. Similarly, if you do have a completely different question, please ask it, and I'll do my best to get as many of those questions in as we can. If not, members of the council team will be responding to your questions on Facebook, and they'll keep responding about 24 hours after this Facebook Live. So if you did want to put a question or a comment, please do get involved that way. And so, as mentioned, our first sort of topic area that we're going to be looking at today is around isolation guidance, and we've received a number of questions in advance about what that all meant. So I'll probably go through the questions and start with you, Sharon, in blocks. But I wondered if first you could tell us a little bit about the changes from Monday.
Okay, yes, I can. So the main change that was introduced on Monday is that for those people who have been double vaccinated, so have had 2 jabs of COVID vaccine, or if you're under 18, you no longer need to self-isolate if you're contacted by NHS Test and Trace or pinged by the NHS COVID app. There are some caveats to that, and we'll get into some of the detail when we're answering some of the specific questions. But just to give a bit of an overview as to what's happening in York with COVID at the moment. Those of you who keep up to date with the regular updates that the council sends out will be aware that we still have quite a high number of cases of COVID infection in York. Our rate had spiked a few weeks ago, as in common with most of the rest of the country. That's now stabilized and the numbers are starting to fall, which is good news. But we're still seeing over 600 new cases of COVID a week. So that still is quite a significant number. We're seeing very low numbers of deaths from COVID, which is really very positive news. But we are also seeing people admitted into hospital, lower numbers than we saw earlier in the year. But the most recent information I have says we have 24 patients positive for COVID at the moment at York Hospital in general beds and 3 in intensive care. So even though the change on Monday is very welcome in terms of, you know, people not having to worry about being pinged by the app, we still need to be cautious about protecting ourselves and others from infection, and I'll be able to talk about some of that as we get into the questions. So that's just a brief overview, Councillor Aston, about where we are.
Thank you very much for that, Sharon. And as you mentioned, we've had quite a lot of different specific questions, understandably, following Monday. So the first one is, I'm double vaccinated. What does the new guidance actually mean?
Okay, so for people who are double vaccinated, you're no longer required to self-isolate if you've been informed you're a contact of a positive case. So by contact of a positive case, we mean that you've had, you may be from the same family, you might have had prolonged contact with someone who has since tested positive for COVID. And so normally we talk about that being within 2 meters or 6 feet of somebody for longer than a 15-minute period. So that means that the problem that we've been living with over recent weeks, where people are being pinged by the app and being told to self-isolate, if you're double vaccinated, you don't need to worry about that anymore. The exception is that there are 2 things to remember. Even if you are double vaccinated, if you're contacted by NHS Test and Trace to inform you you're a positive contact, I'd like you to book a PCR test, not a rapid lateral flow test. They're not sensitive enough for this purpose, but to book a PCR test, which really is just a safeguard, really, to make sure that even though you have been double vaccinated, you haven't picked up the virus. because we know the vaccination isn't 100% protecting people. So doing that PCR test is important. If that PCR test is positive, then you still need to self-isolate for 10 days, even though you're vaccinated. And then the other caveat is if you develop symptoms of COVID at any time during the 10-day period after you've been contacted by NHS Test and Trace, you also need to self-isolate and book a PCR test. Hopefully, I'll just summarize that, Keith, because I know it's quite complicated. So you don't, if you're double jabbed, you no longer need to self-isolate, except if you are develop symptoms of COVID, in which case you do need to self-isolate and you need to arrange to have a PCR test. And I'm still encouraging people to book one PCR test if you are contacted as a positive case, just as a safeguard to make sure that you haven't caught the virus. Hopefully that answers that question.
Thank you very much. If it doesn't, I'm sure we will start to get lots of chat comments and questions that we can bring back later into the Facebook session. Next couple of questions I'm going to ask together, which was one was I've had one jab, and does that mean I have to self-isolate? And then I've just had my second jab. Does that mean I have to self-isolate? I think Sharon, if you could take those together, please.
Yeah. Okay. So if you've had one jab, you still need to self-isolate. That's because one jab will give you partial protection against infection, but not the best protection. And so one jab, you still have to self-isolate. And if you've just had your second jab, what we're saying is that it takes 2 weeks for your body to develop the best immune response from the vaccination. So if you're contacted to say that you're a positive case, you've had your second jab, but your second jab, you got that in less than 2 weeks, you still need to self-isolate. So it's that magic 2-week window after you've had that second vaccine that you just need to remember.
Thank you very much for that. And then related to that, why do under 18s not have to self-isolate when they can spread the virus to others?
So this is quite an interesting question, because obviously we know that children can become infected with COVID and they can pass that on. But the risks of severe illness in children from COVID are extremely low in healthy children and young people under 18. And we have to balance the risk of a child or young person under 16 becoming infected with COVID and passing it on to someone against the broader risks to children of having to self-isolate. So we know, for example, from data that we've collected, that through the pandemic, more recently, we've been isolating children in very large numbers, which means that they've missed a lot of schooling, they've missed contact with their friends, and we know that that has had a significant impact on the emotional health and well-being on children and also their education. So what the government has done, with obviously advice from experts, is that they've weighed up those various risks. and decided that for children, it's important that they get back to normality as quickly as possible. And so they will not be asked to self-isolate unless they are a close contact. And so close contact in this case doesn't means having a stayover, for example, a sleepover with another family, or prolonged extended contact sitting next to each other in the same classroom, in a poorly ventilated area, for example, over an extended period of time. So we are taking a much more targeted approach to how we manage the risk of infection with children and young people, with the aim to be for them to get back to living a normal life. And we will only ask children to self-isolate in very specific circumstances. So that's the reason why under 18s are being treated differently.
Thank you very much, Sharon. And I know when we move on to the next question, Mike, I know you're going to be brought in about vaccine and vaccine eligibility, which obviously will carry that conversation on. Before I go to the next question that we had in advance on isolation guidance, one has come in on Facebook Live, which goes into that conversation about vaccines, but I'll ask it now so that we're responding to the questions as soon as we can, which is, does York have a good supply of the Pfizer vaccine? I think, Mike, that might be one for you to start with.
So, as you know, throughout all of the pandemic, particularly once since we started vaccinating, vaccine supply has been an issue. It's been a concern, but it has, on the whole, kept flowing. And at the moment, we do have a reasonable supply of Pfizer vaccines in stock at Askenbar. I think we've got around 5,000 vaccines in our fridges at the moment. We know that there's a decent stock in terms of finishing off the phase 2 of the program. And now we're starting to learn about the stocks for phase 3, which is the booster program. Perhaps we'll talk about that a little bit later. So the stocks for that are a little bit unclear at the moment, but as it stands for the remainder of phase 2, we feel there are enough vaccines to vaccinate all over 18s and the 16 and 17-year-old cohort.
Great, thank you very much for that. So we'll go back to the questions in advance, and the next one, which was for Sharon, which is, whilst I am double jabbed, I am clinically extremely vulnerable and worried about the risk these changes bring. What is your advice?
So thank you for this question. It's one that comes regularly into my inbox. So it's good to be able to have the conversation about it here. First of all, I absolutely understand the concerns, and I'm sure the majority of people would as well, particularly as we know that the vaccine does provide very good protection against serious illness and hospital admission from COVID, but people can still pick up the virus. So I understand the concerns. The best advice I can give really is for people to remember some of the very basic infection control measures that we've had in place throughout the pandemic. So in this, this is good advice for everybody, but particularly for those who are clinically vulnerable and who are concerned about this. Regular hand washing. I can't stress enough how important regular hand washing is. It doesn't just protect you against COVID, it protects you from other infectious diseases. It will help protect against flu, against norovirus, and stomach infections and gastrointestinal infections. So hand washing, soap and water is best. But hand sanitizer if there is no soap and water available, and doing that regularly. Limiting the amount of contact you have with people that you don't know. So, trying to think about how many people that you're coming into contact with. If you are coming into contact with large numbers of people, particularly in indoor settings, it's still sensible to wear a face mask. And if you are meeting with people that you know, then don't be afraid about asking them to wear a face mask as well, because that's the bit about being kind and respecting each other. So don't be afraid to ask other people to wear a face covering as well in that scenario. And you can also get regular testing. So and encourage anybody who is coming to visit you to be regularly tested as well. So we have really good access to symptom-free testing across York. And even if you are double vaccinated, in the situation that you're in, it's helpful to still be tested regularly twice a week, and encouraging your friends, your visitors, your family to be regularly tested as well. And with those simple measures in place, you can be much more confident that you're protecting yourself from COVID, but you're also being reassured that the people that you're coming into regular contact with are taking those simple measures as well. And obviously, if you have particular health concerns about your own individual health condition, then you can always seek advice from your GP as well, if you're particularly anxious about a chronic health condition that you have.
Thank you very much for that, Sharon. And the more general question on isolation guidance that I'm going to ask Daryl to come in and answer, which is, what support is there for people needing to self-isolate?
Yes, no, thanks, Keith. And I've just come from meeting someone who's their first day out of self-isolation. So it's good to come at a better time. And I know a lot of people are, as Sharon said, still self-isolating. I think, firstly, especially if your employment's affected by having to self-isolate, there is support available both from the council and the government, and all of that information is consolidated at york.gov.uk/self-isolate, all one word. And there's a whole host of information there in terms of payments that can be made and more widely support. I would say, outside of employment, if there's anything that you need, I know we're still having instances of people needing shopping, collecting, and things like that. The council's still there to support you. We've not switched the support email off or anything like that. We're still there and ready and waiting to support. And that email is covid19help@york.gov.uk. And whether it's a CYC registered volunteer or whether it's a council staff member, there is always a whole host of people sat ready and waiting to help. And then a final point would be, if you're not already involved and active in the various mutual aid groups on social media, predominantly Facebook, then do join them. I think we still see today, myself as a ward councillor today, posts, especially in the Rawcliffe one that's very active, just people needing support. And sometimes it's not directly as a result of self-isolation, but COVID has thrown up a lot of challenges for a great many people. And I think I'm always pleased to see just how it doesn't necessarily have to be someone on your street. It can be just the other side of the village or community. But there are, York is a very caring and friendly city, and there's always a whole host of people just waiting in the wings to help you. So I would encourage everyone to join those groups if they're not already members.
Thank you very much for that, Daryl. And I know, like I said at the start, that council colleagues will repeat some of those links and helpline numbers on the Facebook live page. So anybody watching or following along will be able to follow the links directly or get that number if you didn't catch it on the live stream. We've got another question that's popped in from the Facebook Live, which I'll take now before we go on to that general update on vaccines, which was a question around shops not refilling hand sanitizer, and how can we encourage people to be vigilant. I don't know whether Michael, I'll come to you in a little bit on that one, but I don't know whether Sharon, you wanted to make any general comments first. I know just how much work businesses have been putting in at various stages as the guidance changes.
Yeah. I mean, I recognise this, not from York, but I've just come back from 2 weeks holiday in Cornwall. So was really interested myself as we were going around, how many places did still have signs up encouraging people to wear masks and had hand sanitizer very clearly as you walk in, and some that didn't. I mean, in York, we've worked really hard with businesses, and businesses have responded very well to COVID safety measures through the pandemic. But I think it's safe to say that, particularly with Monday's announcement, there is a tendency perhaps for people to think that it's not so important anymore. So what I would encourage people to do is that, you know, if you do notice that hand sanitizer hasn't been refilled, for example, is to raise it with that business in the first place, that shop. It could just be an oversight that they haven't realized that the hand sanitizer hasn't been refilled. So always raise it politely with that particular venue in the first instance. If people have general concerns about poor standards of hygiene, perhaps no hand sanitizer, nobody wearing masks, and a general view that those safety measures aren't there, you can always contact us at the council, and one of the general numbers at the council, and we have the ability to have a friendly conversation with our business just to reinforce the importance of those safety measures. And you know, we have got those relationships and ways of being able to work with that business and encourage them to put those measures in place and follow up and check that in fact those measures have been reinstated. So, you know, deal with it informally first, but contact us in the council if you have any significant concerns.
Michael, I'll bring you in case you want to make any comments about general business support, and also just to say thank you to you with your chair of your bid hat on, because very visible the efforts that the bid have made in and around the city, including with hand sanitizer. Michael.
Yeah, sure. Well, thank you for that. And yes, of course, if on any occasion we fail to keep them stocked up, then please do tell us. Sharon's already said it largely. I think the bottom line is, please come and just have a polite word. I'm sure the vast majority of businesses, if when they have slipped up, will be very grateful for having something politely, quietly pointed out to them, and will respond appropriately. But do bear in mind that lots of businesses have staff off because they've been pinged and so forth. It can be difficult and hard work to keep everything perfect all of the time. And yeah, if you can help in that respect, then that would be great.
Thank you both very much, and thank you to Chloe and Leanne for those questions that came in live. So we'll move on. We've already touched on vaccines in that conversation about the new isolation guidance. There's a group of questions that, Mike, I'll ask you to answer first, and Sharon might want to add. But the first one is, who can get the vaccine now?
Yeah, so the people who are eligible now are first and foremost everyone over the age of 18. So that's cohorts 1 to 12, as we've come to know them throughout the pandemic. That offer is still available. We've now also made the vaccine available to 16 and 17-year-olds. That started a week ago, and we've had a very good response to that in the city. In fact, I think in the first week of offering it to that age group, we vaccinated 1,000 people at Askham Bar. So that was a really pleasing response. And the vaccine is also available to 12 to 15-year-olds who are either clinically extremely vulnerable themselves or live in a household with a parent or a family member who is immunosuppressed or clinically extremely vulnerable. So that is available, but that is by invite only, and we're working with our practices to identify those children and invite them. And the other thing to say is that Askham Bar is still running full steam ahead, 8 till 8, 7 days a week, and we're supplementing that with pop-up clinics around the city. Often at the weekend at the Jorvik Medical Practice on Stonebow. This weekend we're opening up at the Kimberlow Hill practice at the university, and we're planning some additional pop-ups in the sort of centre of town over the bank holiday weekend at the end of the month.
Thank you very much for that, Mike. And I'm gonna throw in a supplementary myself now, which is you talked about it was going really well for 16 and 17-year-olds, and I know it's really early days, but is there anything we can do, those watching can do, to really promote and get that message out there to encourage as many people to come forward?
Well, I think, Sharon touched on it earlier, that the impact of the vaccine program, and what we're seeing is a real disconnection between the circulating cases and the number of serious episodes of serious illness and deaths. And I don't know if the listeners read The Guardian. I'm not an avid Guardian reader, but the data they have on their website is really, really good. So if you just Google The Guardian and coronavirus information, you'll see they've got a whole load of data, lots of graphs. And the important thing for me is that in wave 3, which is what we're in now, the serious illness rates are flat and the death rate is flat. And if you ever needed any proof that the vaccine program is having an impact, it's right there in black and white in front of us. So that's really pleasing. So I think encourage people to come. It's definitely having an effect, and it's really important as we move forward.
Thank you very much for that. The next question that we got in advance is it too late to get my jab now?
So the word that's been used to describe the program is evergreen. So the short answer is no, it's not. So whatever cohort you're in, if you're in an eligible cohort, we will vaccinate you at one of our sites. And as we move into, we'll talk about boosters in a second, but even as we move into booster programs, if you've still not had your first or your second, please come and we'll be able to vaccinate you. So it's never too late. And I think, when people say no or say not yet, that's fine. I accept that, and I accept it means not never. And our role really is about being available for people when they're ready to be vaccinated, and continuing to educate people in sessions like this that it is the right thing to do and it's safe.
Thank you very much for that. Next question that came in has been subject to quite a bit of misinformation that's been going around, but it's is the vaccine safe for people who are pregnant or breastfeeding?
So this is a brilliant question, and a really, really important question, because I think the word you've just used, misinformation, is the key here, particularly on social media platforms. There's a lot of it circulating, and it feels quite frustrating. So the important thing to do here is to listen to expert opinion. And I think, organizations like the Royal College of Obstetrics and Gynecology have issued statements on this to say that it is safe in pregnancy. There is in pregnancy, and it's also, there's no evidence and there's not even an identified mechanism by which the vaccine can impact on fertility. So no way it can affect male or female fertility. There's no evidence that it's not safe in pregnancy, so it is safe in pregnancy, and there is no evidence that it's transmitted in breast milk. So I think we have to be really clear on that, really clear expert advice that it is safe and it doesn't affect fertility. So please do not let that be a reason for you not coming for your vaccine.
Thank you very much for that, Mike. Sharon, you wanted to come in.
Yes, I just wanted to support what Mike has just said, and just to add that I was reading looking at some data and reading some research earlier today, which actually shows there is no link between the vaccine and miscarriage, which is another bit of misinformation that's been circulating. And it's really important that women who are pregnant or are planning to get pregnant, who are worried about this, to have a conversation with an expert. So, have a conversation with your midwife. If you're planning to get pregnant, people can, again, get expert advice on that. And I can't stress strongly enough, as I'm sure, Mike will say the same, this vaccine is safe for pregnant women and for breastfeeding women. And there is no reason why they can't receive that vaccine safely. And really to try and listen to experts, as Mike has said, and try not to get sidetracked by some of the misinformation. There's lots of misinformation out there. Don't believe it. Talk to the experts who have all of that information to hand.
Thank you both very much. The next one, which follows along with that, is why should I get the vaccine if it doesn't 100% protect me from getting COVID? And I think, Mike, you really gave the answer there in your one as to what impact has it had. But I'll go back to you in case you wanted to reinforce that.
I mean, let's reiterate it. I think first to say is that no vaccine, I'd go as far as to say no medical treatment is 100% effective. So this is no different. So let's not worry about that. It's highly effective, and we saw the data around that earlier on in the pandemic. And what we're clear about now is that it reduces the risk of catching the virus, it reduces the severity of the illness, and it reduces the chance of passing it on to someone else. They're really clear from our experience so far. And remember, in the UK now, we've administered almost 100 million doses of COVID vaccines, which is a huge number. So it protects you, it protects others, and it protects society. There's no doubt about that.
Thank you very much for that. Next question, which is one that you'd mentioned at the start and a very topical one, is what's happening with booster jabs?
Yeah, so we're building up to the booster program, and I think we're hopeful that will go live in September. There's still a little bit of uncertainty as to the exact date, but we're hopeful maybe around the middle of September. We're going to be delivering boosters at Askham Bar on behalf of all GP practices in the city. So that's a really important point, that the practices are all working together. Nimbus Care is owned by the GP practices, and we're going to be delivering the boosters in the same way that we've delivered the vaccine program, with the bulk of it at Askham Bar, with pop-ups around the city as and when required. We think it's likely to be the Pfizer vaccine, but again, we're just waiting for final confirmation on that. And as we've already talked about the supply, we're also waiting for final confirmation about that. So lots of unanswered questions for us, but we're planning to start mid-September, and we're planning for it to be a Pfizer program.
Thank you very much for that, and I'm sure we'll share more information, and you'll share more information as soon as that becomes available. And one, Sharon, I thought you might want to answer first, and that was our last question that we got in advance on vaccines, which is, do I still need to get tested if I've had the vaccine? And that obviously relates back to some of your earlier answers, Sharon.
Yeah, so even though people are double vaccinated, we are encouraging people to continue to have regular symptom-free testing. I mentioned earlier at the start of the session that even though our numbers of cases are starting to fall again, they're still quite high at over 600 cases a week. That still is quite a high number. And so one of the ways that it helps us to understand what's happening with the pandemic locally, and also to identify where there may be hotspots, whether there's more we need to do around prevention measures and to be supporting communities, is to understand what's happening with positive cases. And so having regular lateral flow testing twice a week helps you as an individual. It gives you that reassurance that you're not infected. But it also helps me and my team kind of look after the city by understanding what's happening with cases, etc. And so there are two reasons why regular testing is important. And obviously, I'm talking about symptom-free testing there. But if you're double jabbed and you develop symptoms of COVID, then it's still important that you go and have a PCR test.
Thank you very much for that, Sharon. And I can see, Mike, that you wanted to come back in, but before you do, I'm going to throw in a second question for you as well that's just come in on Facebook Live, which was a question from Mike, as it happens, but I'm sure a different one, which is, why is it that we're making pop-up clinics now, yet older people had to travel outside of York to places like Leeds? And I'll go back to you for both answers, please, Mike.
Okay, so I think the reason people went to Leeds or had to travel outside York at the very beginning was around vaccine supply. And that was with our control. What happened at the beginning is that we found that our older and more at-risk cohorts were very keen to be vaccinated. They came to Askham Bar, they were brilliant. For those who were housebound, we went to them. There were some pop-ups at the very beginning. We had pop-ups at Haxby and in Pocklington, and they were well attended to. And you know, if you look at the percentage of the population that we vaccinated in those older cohorts, we're almost 95%, which is incredible. And if I put that in the context of a normal flu year, which would probably be in the region of 70%, it gives you a feel for how well attended they've been by our older patients, our older residents. As we've moved through the cohorts, for whatever reason, particularly when we get to our younger residents, attendance has not been as good. They have been less keen to come forward for a variety of reasons, which we probably haven't got time to go into here. But what we're trying to do is target them, take the vaccine to them. There are some wards around the city where attendance has been poorer, and we're responding to that. So we're responding to the data and to the behavior of our residents. And I think that's entirely appropriate. And by doing that, as I say, we're over 90% coverage for 2 doses and over 70% for 90% coverage for 1 dose and over 70% for 2 doses, and making progress all the time. So I think what we're doing is working. The point I wanted to raise and why I wanted to come back was just to talk about flu, because as I was talking about boosters, I thought I ought to have mentioned flu. So the flu season is going to be starting soon, also in September. That's going to be more distributed. So it'll be available from practices, from community pharmacies, and also from Nimbus Care. It's going to be available to everybody over the age of 50, people with long-term conditions, and health and social care staff. And I just want to make a plea for people to go and get their flu vaccination. Obviously, we saw fairly low figures of flu infections in 2020. And I think in part that was because of social isolation, the lockdown, the hygiene measures we were taking. But the experts are telling us that there could be a rebound this year. So please don't be complacent. It's really important that you go for a flu jab when you're invited to do so. Thank you.
Thank you very much for that, Mike. And I'm absolutely sure that is a message that Sharon and the council will be keen to repeat as much as is possible. And now I'm really conscious of time, and I've just been reminded that we have 15 minutes left. So I'm going to move us on to the next section, which was questions that we'd received about the economy and about business support. And I'm going to go to Michael first. And the question that came in, which is quite a broad question, but I think it will start off the conversation, is how have businesses been affected since the easing of restrictions? Okay,
well, yes, you're right. To some extent, the only statistical information is the stuff that was given at the headline at the front of this meeting about footfall figures being higher and so forth, which is great. I think one of the other things that's fairly obvious is that there are all sorts of businesses that have been very badly affected by their staff being asked to isolate. I mean, in my case, both the businesses I run, that happened for periods of just over a week. That was very damaging. There's no two ways about it. And unlike the actual lockdowns and so forth, there's no real compensation available for this, and it's quite difficult for businesses to cope. That said, I think the people who were in businesses that were in very vulnerable positions probably were no longer trading by the time we all reopened, and it doesn't seem to have pushed people actually over the edge per se, even though it's been clearly highly damaging. The great thing is the fact that people are in York in substantial numbers, and no doubt that's related to the fact that more people are spending their holidays in the UK than one would ordinarily expect. I think, therefore, and this sort of, I can't prove this to be the case, but anecdotally it seems to follow that those city centre businesses that are in and around the tourist routes and are doing very well, and those that are perhaps a bit more remote, those that tourists don't regularly pass on an ordinary basis, aren't necessarily doing quite so well. Now, I can't prove that to be the case, but it does sort of follow from what we know is driving consumer behaviour. So, I mean, broadly, this is good. It's good, but with some very severe caveats. And given that the rules on self-isolating have now changed, I think many people are hoping that's beginning to come towards an end. Of course, I run a hospitality business. Many retailers are in very similar positions. A lot of our staff are really quite young, and so we're not out of the woods yet.
Thank you very much, Michael. I think what you just said to me emphasises that real message of not just shop local, but support your local businesses. And as you say, we're fortunate to be in a city that a lot of people want to visit and spend money in, and long may that carry on for local businesses. But it's equally really important, whether that be in villages, suburbs, or, as you say, those areas of the city centre, perhaps not quite as well known, that we all continue to support local businesses. And I think one of the things that a lot of communities actually came to really appreciate in the middle of the pandemic was that real support from your local business and making sure that people could get what they needed. And I think there's that real strong message that we need to keep going back to keep supporting them wherever you are. And go in and do that. And it is probably linked to the second question that came in, which was particularly about your business, the Chopping Block, and also your work in the York Food and Drink Festival, which is how is the hospitality sector in particular faring in York?
Yes, well, I think, yes, that thing about local businesses, yeah, it's either, it always has been the case, but I think perhaps the pandemic's made this more obvious to people. If you don't use local businesses, you will lose them. It is the bottom line. And, then there are real contexts in which you will come to regret that. However much it's easier to order everything online in some contexts and so on and so forth. How are we doing? Well, yeah, we are not doing as well as people in the city centre, but we're not doing badly. Our numbers are broadly somewhere approaching where they were last year. What we're missing is large functions and tour parties, which is not surprising. And we're beginning to see signs of them thinking about their Christmas parties, the odd overseas tour turning up in late September and onwards. There are signs of of light on the horizon there, but we've got a bit of a way to go. As for the sector as a whole, then again, I don't think people need to be told that hospitality has found itself having a lot of problems recruiting skilled staff. At the entry level, not really much problem. You can pop a job up on Indeed or wherever, and if you just want a frontline barman, waitress, whatever, not too much problem. But skilled chefs, more senior front of house staff, and hotels, people in other senior positions, proving difficult because some of those staff have found other things to do during the lockdown. And there's, to some extent, this has just revealed some long-term issues that the industry always had. So the more that we can do to encourage people to be, to take up what are exciting and attractive careers in hospitality is, front of house and to be a chef and so forth. It's a job I've loved doing for years. I think that we need to do more work there, and that's been, I'm conscious the city and the Lord Mayor held a hospitality summit and, made an effort to get that agenda moving along. And we'll be doing that in the Food and Drink Festival as well, so that, giving young chefs a stage as young chefs, it's a junior chefs competition. We've been in discussions with the Hospitality Association on how they're going to promote jobs and careers in the industry with us. And yeah, there's work to be done, and we are setting about doing it with enthusiasm.
Thank you very much for that, Michael. Next question, I'll ask Daryl first, and then I'll come back to you, Michael, which is, are you able to touch on some of the events and activity that has been taking place, and obviously particularly there with a reference to the city centre, Daryl?
Another question that could take all evening. Obviously, I think everyone knows just how much there is right on our doorstep. I was visiting music venues this morning. We've got fantastic facilities, and I think just generally, I know what quite a few colleagues have enjoyed is sort of pretending you're a tourist for dare I say, a day, a week, even longer if you like, the whole summer, and do enjoy what's on our doorstep. I know, similar to the discussion we've just had, our visitor experiences and attractions have had a really tough time of it, and absolutely are appreciating people coming back through the doors again. For instance, I would point to the Things to Do guide on York Mix, which is co-sponsored by Make It York and the council, which does do a fantastic job of consolidating those sort of things that you really wouldn't see, and might be a new experience, be it an indie concert or a book reading. I'd also point to visityork.org/events, and I think that's going back to being a tourist in your own city. There are a whole host of things to do. You're never sure. I've just looked at what's on this evening, and unfortunately I'm not able to get out. But there are so many things, and I think just generally a bit as Michael said, do sort of as Michael said, if you have booked somewhere, do go. I think some certain exhibits are sold out, and that capacity issue that we've talked about, a lot of venues are still operating at 70%. So therefore, when you don't go, it does make a bigger impact than it would otherwise normally.
Thank you very much. Almost a concluding question there as to whether you'd go to an indie concert or a book reading that I could go back to Mike and Sharon on, but I won't. That'll be for another Facebook Live. Michael, I wanted to come back to you on that one, just in terms of events and activity, and obviously the planning for the Food and Drink Festival.
Yeah, okay, well, very, very briefly, the Food Festival is taking the obvious step of trying to thin itself out slightly from Parliament Street and spread itself more widely across the rest of the city. That was a long-standing ambition, but obviously it actually helps people achieve their COVID sort of safe objectives. So you'll be able to, make pasta in the museum gardens or bread in Coppergate Centre, as well as making cream into butter in Parliament Street. Now, I'm not actually sure those locations are going to be the exact ones with those activities, but it gives you an idea that this year's Food Festival will be more widely spaced across the whole city centre, and it's a great hands-on opportunity for families to come and to enjoy themselves in York. And we are taking, the bids already fill the city centre with sanitizer stations and so forth, but it's a largely outdoor open air activity. Even the large marquees have astonishing amounts of ventilation available in them, so this is as safe and as sensible an event as one could possibly put on in York in late September. We're looking to see 1,000 primary school children turning up in the midweek to do those cookery sessions, and we're looking to see residents and visitors. And in most years, 66% of our visitors are residents. We are fundamentally a resident event, and we put an event on, and it has a benefit to the tourist industry. But fundamentally, events in the city centre can and should, and in our case, in many cases, usually are fundamentally about residents first and foremost. And I think that's something we need to move forward to. We're not about we need to get away from the notion that events in the city centre are about raising money for to subsidise something else. And actually, they need to be great events in the first right, in their own right, and that's what we're aiming to achieve in the Food and Drink Festival.
Thank you very much for that, Michael. I look forward to coming along and experiencing it. I'm going to squeeze in one last question with you, Daryl, which is how are clubs and organisations being supported at a more local level?
Yes, no, thank you, Keith. And this is a great opportunity just to plug the a brand new £25,000 small grants fund for local sports clubs and organisations. And this is really aimed to sort of further their work with local communities in order to reduce health inequalities across our city. And really get more people involved in sport. And I think various things have done that. The first lockdowns with people rediscovering parks and open spaces in their areas, but also most recently with the Olympics. I know anecdotally gyms are far busier when Tom Daly's just been diving, and I think the legacy of that will continue. And I would just say, to apply, every club must make a commitment to champion mental health and wellbeing within their club. And I'm really pleased applications are open until the end of August. And you can apply just on the council's website, and the maximum is £500 is available for each successful applicant. And for example, last year, West Bank Park Bowls Club bought some kids and families bowls equipment to allow more children and their families the opportunity to play sport of bowls. So it's that sort of thing that really gets more people involved in their local clubs and communities. For more general support, and it has been a really tough time for local clubs and organisations, do just email sport and active leisure at york.gov.uk. There's a fantastic sport and active leisure team that, from planning applications through to advice on where to get the best nets, they are a fantastic team and will support you in any way they can. And more widely away from sport, any clubs or organisations or community centres that need advice, I think it is often people giving up an awful lot of time that make these facilities the brilliant spaces there are. And do email Shaping Neighbourhoods at york.gov.uk, and advice will be available for anyone managing a community centre or local group. For instance, you can join our community centre network and speak to the fantastic officers at City of York Council that are there to support you. So really, I think that's the message. Really, we massively rely across the city, across its villages, on these local groups, and the council is there to support you.
Thank you very much. That gives us a little idea, from indie festivals to book reading to nets to bowling to food and drink festival to supporting local businesses, and just how much is going on. And I know all of the effort from those businesses and volunteers to make all of that as safe as possible for such a long period of time now. And just one final comment for me is that a lot of the links and the information that we've mentioned today, particularly in relation to vaccines and isolation guidance, have been included on the Facebook Live in the comments section, and that includes the information on where you can grab a jab. So do have a look on Facebook Live and make sure you have a look at that information, and please similarly share it with any friends, any groups that you can, to make sure that information gets out there and gets to the right people. With an eye on time, I'm going to have to start drawing the Facebook Live session to an end. Just like to thank everybody that asked a question in advance, asked a question on Facebook Live, and similarly, as I did at the start, just to thank our panelists for your time yet again on one of these sessions. It really is appreciated, and I know a lot of people watch these sessions live and then after the event. To anybody watching, please do keep leaving your comments and questions. As I mentioned at the start, council team will keep responding to them in the next 24 hours with whatever you have to ask, or if you wanted to check any of the information that's been given to you. But a final thank you all for joining us, and we'll see you for the next Facebook Live. Thanks all. Bye-bye.